When we think about tuberculosis, it really is a global problem. If you look at the statistics for the world, 9 million new cases. And South Africa, we probably are one of the highest burden countries in the world. And here we're looking around over 300,000 cases reported in 2013. In South Africa, 3.5% of tuberculosis new cases are drug resistant. It was a national priority to establish a reference center for the country. There was a need for a facility that would adhere to the WHO recommendations for biosafety. And secondly, provide a safe environment for the workforce who are performing these tests in the country, and really addressing the need of lack of these type of facilities in South Africa.
When the National Institute of Communicable Diseases asked us to become involved in this project, we were quite excited because we know what a big problem TB is in South Africa, and we really want to be part of the solution.
TB is a curable disease, and that means that patient needs to get tested in order to get the right treatment. In order for us to establish what drugs to treat with, we need susceptibility testing done on culture isolates. And that really can only be done in a culture facility like this one we're sitting in.
We've got a team of professionals that are experts in designing controlled environments. We specialize in two types of facilities, the clean rooms. They typically manufacture medicines. Our main aim there is to support our clients to maintain GMP compliance. We also specialize in containment facilities. Our main aim there is to ensure the safety of the workers as well as the public.
The reason why we chose Royal HaskoningDHV is that they're one of the only companies in South Africa that firstly can interpret the WHO recommendations specifically for facility design necessary for culturing laboratories, and also implement the process.
The way the facility addresses the specific requirements for tuberculosis research is we have a unique understanding of the guidance published by the World Health Organization, making sure there is proper changing facilities so that personnel using the facility can wear the correct garments. It ensures that there's correct or adequate levels of biosecurity. We ensure that only 100% outside air is used in the facility. There's always a movement of air from areas of a low containment risk towards areas of a high containment risk. Any air that is allowed to leave the facility, we ensure that this air is treated from the release of any contaminants, thereby protecting the general public.
So this facility really is the national reference laboratory for the country. So we do specialized testing. We test new drugs that other labs are not doing. We partake in research that are global projects, and we also monitor resistance to new drugs, which will help a lot in the treatment of patients for the future. At the end of our research, we will have estimates for the population with regard to drug resistance, and this will help inform national policy with regard to guidelines and optimally improve a patient's outcome and cure.
We're currently involved in a number of laboratories. A number of these are sites in hospitals, and they're often smaller laboratories, but no matter how small the project, we're always looking to assist where we can.